Hi, everybody. Welcome to this week's installment of Sidebar Conversations. So, with the dermatology content, I try to find things that you would find helpful, obviously. There's a lot of stuff in the derm chapter with a lot of definitions and terms and, of course, all of the different conditions. So I wanted to talk about, first off, having a really good dermatology reference. So I'm going to post a link in this week in this module for my personal derm reference that I absolutely love. It's kind of like a pocket guide, and it almost looks like a bunch of paint chips like if you were to go to Lowe's or Home Depot. And it has tons of pictures because we know not all dermatological conditions look the same, even with the same diagnosis. So it shows a bunch of different pictures of the many different diseases. And on the back of those pictures is the treatment. So it's really nice. I have taken that into many different exam rooms, compared the pictures to what I was seeing on the patient, and it was really helpful. One and done, flipped it over, there's the treatment. So I'm going to share that with you. Also, I wanted to talk about like really basic wound care management and primary care, because you're going to have patients come to you with cuts and scrapes. Obviously, you've learned the basics of wound care management for wounds that you've had to suture or things like that. So that you've already had. But people are going to come in with you with, good sized cuts and scrapes and things that don't require sutures, or you can't use steri strips on, or things like that. They're going to ask you, well, how do I take care of it? So I just wanted to go over that really quickly. So not all wounds are infected and need antibiotics. So obviously, if they're not red and swollen, there's not nasty drainage, or the mechanism of injury wasn't anything that's concerning for infection, you don't need to automatically put somebody on antibiotics. Another really popular thing is antibiotic ointment. People will always ask you, well, can I put triple antibiotic ointment on it? And it's not necessarily a bad thing, but it's not always needed. So I usually say, well, for the first one or two times, if you want, first couple days, you could put a little bit of antibiotic ointment on it if you want, but you don't really have to. Soap and water to get all the gunk out of there is fine. Changing the dressing once a day is perfectly fine. Soap and water. You don't have to use anything really stronger than that. A lot of times people like hydrogen peroxide. I think it's kind of an old school way to clean wounds, and you don't want to use it on a really deep wound, but it's okay for minor cuts and scrapes for the first time, because the bubbles in the hydrogen peroxide do a really good job of getting a lot of the debris out. But if you use hydrogen peroxide on good healthy tissue, like if they keep cleaning the wound with hydrogen peroxide as it's trying to heal, it actually will break down that good tissue and do the opposite effect. It won't promote wound healing. So hydrogen peroxide, okay for the first time to wash out the wound if you wanted, but otherwise, soap and water is fine. Another common thing that I've seen is people will put a big glob of triple antibiotic ointment over the cut or scrape or whatever it is. You don't need that. A thin layer is perfectly fine. And, wounds need to be a little bit on the, have moisture in them in order to promote healing. You don't want a wound to dry out. And, of course, you don't want a wound to be too wet, because if it's too wet, then it gets macerated and it doesn't heal right, or it takes longer to heal. So that's why we put a lot of dressings on when there's a lot of drainage, to keep the underlying wound not as saturated. So when people put a big glob of antibiotic ointment on there, sometimes it can make the wound a little more wet than it needs to be. So a nice thin layer is perfectly fine. And then once the wound is scabbed over, they can leave it open to air. So the dressing is important in the beginning stages of wound healing to keep all the bacteria and dirt and debris out, especially depending on what somebody's occupation is or what they do. The importance of the wound covering is that, to keep the good stuff, the bad stuff out while it heals underneath. But once the wound is scabbed over, we don't really need to worry about dirt and stuff getting in there. So people will have their wound dressed until it's completely healed, and then you don't really need to do that. So that's another common mistake that I've seen people do. So anyway, that's my sidebar. Hope you learned something, and have a great rest of your week.